Hello, physical therapists. My name is Meg Kopka, and I'm with Avacen Medical. You're about to see a clinical presentation on the miracles of microcirculation with Dr. Denise Tropea. Dr. Tropea talks about how all of our small vessels within our body, like our capillaries and our venules, are not only the key to our body's healing, but really the key to in achieving optimal health and wellness. Dr. Tropea also discusses how she uses the Avacen Medical device in her practice to reduce pain and inflammation and increase microcirculation. And the Avacen is an FDA cleared class 2 medical device that is non-invasive, drug-free, zero side effects, and COVID friendly. So without further ado, enjoy. Hey guys, it's Meg Kopka with Avacen Medical. I'm really excited to be able to talk to all the physical therapists on the line today and introduce Dr. Denise Tropea. Dr. Denise Tropea is a board certified foot surgeon, and she's maintained a private practice in Las Vegas for 25 years. She is originally from New York, New Jersey area, and she completed her studies at the Scholl College of Podiatry in Chicago. She then went on to complete a 2-year residency in surgery and orthopedics in Salt Lake City. Dr. Tropea has been in the healthcare field for more than 30 years. And in 2016, she closed her private practice in Las Vegas to follow her passion in health and wellness. She still works part-time as a podiatrist with a special interest in diabetes and its complications with lower extremity wound care. Dr. Tropea is truly a health educator, assisting people in regaining and maintaining their health. She bridges mainstream medicine with proven alternative medical modalities. She believes we all have the potential to empower ourselves and live quality lives. So Dr. Tropea, I'm so excited to have you with us to talk about the miracle of microcirculation.
Yes, pleasure to be here. Good afternoon, good morning, everyone.
Yes, and so I suppose we should start off with what is microcirculation and why is it so important to us?
Well, it's just really the cornerstone of our optimal health. We need to, feed our bodies with the proper nutrients. And by the way of getting there is through the bloodstream and through the red blood cells, and how nutrients as well as toxins and that whole exchange needs to be done. And at the microcirculation level, at that level, it is where all the action is taking place. We think of, our blood flow as, with the big pipelines in our body, but really where all the action is taking place is over 80% of our microcirculation that is actually feeding the cells and making sure that they are healthy.
And those are all those capillaries and venules versus...
Yes, and we're going to talk about all that, the arterioles, the venules, and then the capillaries that are the connectors, and how the blood has to get through there in order for it to detoxify, to send nutrients to those areas. And that's why we see so many changes in a positive way that will happen with the Avacen machine, is because we are enhancing the circulation. We are making it the best we can. And the science behind it is just so fascinating. And it is able to help so many people on such a grand scale.
So talk to me more about, blood flow, the circulatory system, and everybody understands how important circulation is, but if you talk about it in overall health, whether it be, helping to heal. I'm out in New England, and the audience is New England based. So you talk about Tom Brady, his whole TB12 thing is all about pliability and getting more blood flow into the tissue, more oxygen so it can heal faster, so you can recover faster.
Yes, that is so true. When we look at different overuse problems, sprains, strains, muscle injury, what has to be there first is the blood flow. The blood flow has to get to an area. The same thing with even arthritis. When we have arthritis, that's what's happening, is that there's inflammation around that area, and we need to get the blood flow there in order to bring all those chemicals in order to reduce the amount of inflammation, as well as helping the lymphatic system, which I will talk about as well, that works in tandem with the vessels, the blood vessels, in order to get all that debris and everything cleaned up and detoxifying. So if we don't have that constant blood flow, the nutrients, detoxification, et cetera, this is the way the system works to keep our bodies as in optimal health.
And do you feel like is so I had never really heard of microcirculation. Is it not a regular term, or is it starting to become more popular with research and talking about the true optimal health of the body?
Yes, I think more and more people are aware of it. I find that when people actually talk about like microvascular disease, we're talking a lot about even the brain, because there are so many small vessels, and the same thing with the eyes and the kidneys, and of course the small vessels that are in our hands and our feet. And people are saying, well, what can we do to help that out? Well, we see that with small vessels, you can get a lot of oxidative stress. And when you have oxidative stress, what's happening is that you're getting damage to those very, very small vessels, and they become clogged and they become diseased, and they just close off. And so how much of that damage is there before you have kidney failure, before you have blindness, before you have the brain disease, dementia, Alzheimer's, that sort of thing. Years ago with dementia, they really didn't know that a lot of it can be due to impaired, blood flow, to the brain through the, carotids right here, and the main pipeline here, and here the aorta, and then as it also, goes down to the legs, the vascular issues, and then what things can contribute to that. Smoking and, not eating properly, high cholesterol, and also genetics, will play a part as well.
There was an interesting study out of Cornell just recently, and it talked about if we could find ways to increase the circulation in the small vessels of the brain, that we could find treatments for Alzheimer's. And I thought that was so fascinating, because again, that hasn't been something that's been spoken about too often, except for most recently.
And yes, and we see more and more, whether it be that, yes, we do have an increase in the elderly population. Yes, we do. We've really mounted up to that point in time. And, also, just because you are older doesn't mean, your mind has to be impaired. Mm-hmm. But it could be a fact of lifestyle, like I said before, the foods we eat, not getting proper detoxification of our body. I'm very much into that as well. I think it just all goes hand in hand. Mm-hmm. With oxidative stress, and how that plays such a part, especially with diabetes being the small vessel disease.
Absolutely. And I'm really excited to get into some of the graphics and the slides that you have too, to really kind of bring that whole picture together. Because I just think this is such a fascinating subject, and one that, requires such discussion around it. And without further ado, would you like to take over?
Alrighty. Okay. I always like to start off with the disclaimer, so then we can really get into the nuts and bolts and talk about different things. So the statements contained in this presentation have not been evaluated by the Food and Drug Administration. The products discussed are not intended to diagnose, treat, cure, or prevent any disease. Okay. Now we can start with the fun stuff.
Get all the business out of the way.
Yeah, get it all out of the way. So what's at the root of poor health? I mean, we can really talk about everything from a cellular basis and also talk about the fluid imbalance between the blood and tissue. And yes, that can cause swelling, not being able to get rid of the toxins in our body. And then a weak immune system. And, you know, that could be a story for another day on the importance of strengthening the immune system, keeping it in the tip-top shape, especially in the world we live in today.
Mm-hmm.
It has never been so important to make sure that our body is doing what it can to fight the everyday toxins that we're confronted with. You know, the water we drink, the air we breathe, the foods we eat. I mean, sure, there is a balance where, you know, there are times where we can't, you know, we don't live in a bubble. We live amongst the masses. And we know that the certain problems that have been plaguing us for years could be due to our environment and what things we need to do to detoxify our bodies. So once again, you know, poor health, all these things can lead to it. And then we can go as far as saying, you know, poor thermoregulation, not having, you know, the proper body temperature in our body. Our bodies are always at a colder level in which we are getting constriction of our vessels in order for the body to keep the core temperature at bay, but also then our extremities are at a disadvantage. Poor oxygen exchange resulting in waste and toxins, carbon dioxide, and not being able to get filtered out. And then oxidative stress, which is the damage to our cells due to free radicals and not enough antioxidants to combat that in order to neutralize them out. So we talked about some certain biological issues, but people may not recognize that the things we just discussed can lead to disease. Because we really don't know what's happening on that cellular level of our bodies. You know, we wake up, we go through our day, we have our meals, we, you know, maybe we have stress, maybe we exercise, maybe we don't. You know, we just don't know what's going on except for how we're feeling, different symptoms that may result. Maybe we go for blood work, go for different testing, and then certain things are becoming evident, such as, you know, diabetes. And we know that diabetes is such a huge problem in this country as well as globally. We have over 29 million full-blown diabetics, and then 1 in 3 people are pre-diabetic. 1 in 3 adults, wow, pre-diabetic. Yes, it's a big number. It really is 1 in 3. So those 100 million people that are pre-diabetic, not full-blown, but could have the potential to be, then they go into a type 2 diabetic realm. And a lot of it does have to do with, you know, lifestyle. Yes, we said before genetics can play a part, but your DNA doesn't have to be, you know, your destiny. Mm-hmm. To say, my parents had it, so now I have it. You know, there are things you can do. You know, a lot of it does come with nutrition, the proper diet, exercise, and that basically is, you know, doing something that you enjoy. So we'll talk a little bit more about that later. But also when we look at like brain diseases, as we discussed before, we see that you know, there's so much insult to that microcirculation that certain parts of the brain will not function properly. And then kidney disease, kidney failure, undiagnosed high blood pressure, or someone that has not had it treated, or maybe did go on medication, then off medication, you know, it could wind up causing kidney problems. in which those little vessels just clamp down, and eventually the kidneys do not work. So you get the buildup of toxins. So what's your next step? It's so sad to see people on, dialysis. So what do we mean by microvascular? When we break up the word into two parts, we see that micro meaning very small. The very, very small areas of the vessels that are feeding the organ. And then vessels mean conduits, so it's the little roadways that we have. So the way I like to look at it is that the aorta and the big arteries are, the main freeways. But then when you get off the freeways into the neighborhoods, that's where like all the action takes place, and that's the microcirculation. And that's where really all the blood has to go to in order to do the job. So that's the real, culprit of not having proper microcirculation. It's the dysfunction that will happen, thus causing disease.
How do you, Dr. Tropea, how do you know if you have insufficient or a deficit in microcirculation?
I think it's very difficult to quantitate. I think when we look at, like, say, for example, if we get a test done that may just take the pressures, it's called a Doppler exam, arterial Doppler, that you can see what the big pipelines are doing. But when you actually want to see when you don't have proper microcirculation, that comes with more involved testing. Angiograms, that's where they can really see what's happening with those arteries. But, they can only get to a certain point with the smaller ones. But I would say definitely with invasive vascular exams, you can see that where there's problems, especially when they do catheterizations, cardiac catheterizations, and they can really get an idea of what's happening with the heart, the different areas that are not being fed. Then you know that the microcirculation is probably not working well, because certain areas of the heart are are dying off, not functioning properly. And I would say the same thing like with the lower extremity. There's different testing that can be done. Say, for example, something's put on the toe, a little adapter's put on the toe, and we can see how much blood flow is actually getting there.
Oh, wow.
And if it isn't, then we know that there is a problem with the microcirculation because the little vessels are just not working anymore. And that's why with diabetes, it is a small vessel disease. And we see so many times, it's so sad when people go blind and they go on dialysis and then they wind up losing limbs because of the microcirculation being impaired. Yes. So with the microcirculation being present in all your organs and tissues, and these vessels such as the arterioles, the capillaries, the venules, these all have to work together in order for the arterioles to carry oxygen and the nutrients via the blood cells to the capillaries, and then flows out of the venules and the veins so it can go back to the lungs, then get, oxygenated, then back into the heart. The whole system goes over and over and over again. So it takes about 20 seconds, 25 seconds or so for that whole system to get so it just keeps going. So it's just amazing, what the human body can do. It's also amazing how much insult it can take as well. It's resilient to a point. And I think with circulation, that's where it's at. What I've seen over the years, being a lower extremity specialist, is that you can get to that point to try to save a limb. But if it gets to the point of no return, then that's where you have tissue death, where there's just no more nutrients that can get to an area because there's just so much congestion and clogging. of that.
So we want to get the microcirculation flowing. We want to make sure everybody has healthy tissue, healthy cells.
Exactly. Because really, how does it work? Well, it works because the vessels of the very, very small microcirculation, they're lined by, we say, endothelium, okay? So it's flat cells that regulate the movement of water, materials, it has to. And then also it has to work by a little propulsion, okay? It works by a certain amount of, your heart's beating, so it's, getting everything pumping through your arteries, etc. But these parasites, they're surrounded by the cells and they're made up of the smooth muscle. So the smooth muscle, it's helping it along. So when the vessels will lose these parasites, then they die, they become hyperdilated, hemorrhagic, and this leads to a lot of damage, especially when you have like bleeding in the eye, retinal damage, probably from diabetes. Also with the kidneys, it could be the same thing. And then also with the small vessels of the feet, get the same thing where if they die off, they become injured. And they're becoming injured because they're not getting the blood flow. There's a lot of, once again, the oxidative stress, the cholesterol that could build up, the plaque that builds up around there. That all plays a part. So the main job of the microcirculation, deliver oxygen and the nutrients, remove the carbon dioxide, and of course, regulate the blood flow. Too much constriction, it's not going to flow. When you open it up and dilate, then you are going to get the flow. So that's why we'll bring in and talk about the autonomic nervous system, which is the sympathetic and the parasympathetic. And we'll talk about that in contrast on how the sympathetic, that's the fight or flight mechanism, and everything clamps down. And cortisol gets produced. Your body is ready for a fight. Although there's not a fight there, it's just the stress that your body's under. Then you can go to the parasympathetic, in which you have vasodilation, and the vagus, VAGUS nerve, then becomes about and starts calming the body down. And also you're getting chemicals such as dopamine and serotonin that are being produced, and it is helping the body to relax itself. And once it relaxes, that's when it can get nutrients to the vessels that it needs. So I'm going to talk a little bit about the lymphatic system, because that's the drainage system. And it works in tandem with the arteries and the veins. As you can see by the schematic, it's all closely related. It collects fluids and proteins that's escaped from the cells, returns it back to the blood, because if it's not doing that, we wind up getting edema, swelling. And we know with so many disease states, especially if you are post-surgical, if I do surgery on someone, especially on the lower extremity, being so far away from the heart, and then with gravity and all that, swelling can linger for a long time. But when you have something such as the Avacen machine, what you're having it do is you're helping with that system in order to get it all cleaned up. And if that happens, what you're going to see is that swelling will definitely be improved. Now, swelling that is fairly recent has the best chance of being eliminated. And I'm sure with the physical therapy audience, they can appreciate that swelling is important to get the healing to begin. Taking away the swelling, excuse me, is very important, because it's responsible for removing the toxins. It's responsible for removing the fluids, maintaining that delicate balance between the blood and the tissue, so you don't get the fluid in the tissues. So that's what I have seen over the years, is that if I can reduce swelling, whether we use compression, in this case, using something like the dry heat modality with the negative pressure, the Avacen, you're getting the toxins to be taken away from those areas, brought into the lymphatics, and having your lymphatics work better. Yes, it is very difficult when someone has, let's say, lymphedema, in which the tissues have become so hardened, and we call it, brawny edema, let's say. It's so difficult because the tissues are so hard and they're not responding. So really anyone that has so-called pitting edema this can be very much drained out of the system fairly easily. And what I have seen with my patients from a post-surgical or even someone that has had chronic swelling for years, maybe due to their lymphatic system, when you do initiate something to help get the toxins out of the tissues and back into the blood so it could be detoxified, it can really be a big help. And also with the lymphatics, it's a key player with the immune system, and that also helps clean up any type of infections that you may have. I've seen over the years cellulitis in the lower leg, very difficult to eradicate when someone is impaired with comorbidities such as diabetes and different type of immunocompromised disorders such as rheumatoid arthritis, because their body is just not working effectively to clear the infection. So if you can get their bodies to begin to heal themselves, then hopefully it's a start in the right direction.
And Dr. Tropea, just if I could ask a question, you've mentioned the Avacen a few times, and we'll definitely get more into the Avacen device in a little bit. But what other, and the Avacen increases microcirculation. However, what are the other modalities in the past, before this technology came out, that you would use to help clear the lymphatic system?
Well, I would say through massage, compression, then sending them also to therapy as well. Just anything you can do to get it moving, get it mobile. When we talk about trying to increase circulation from a more of a athletic level, you're looking at things such as different stretching and exercise, contrast baths, different things like that to help increase that body temperature. But here we have with the Avacen, when you put your hand into the machine and you have the dry heat and the negative pressure, it is able to increase that temperature 1 degree in the body. And what that does is some remarkable things. And we'll discuss that, what it does. And it's just amazing the way the body will do what it needs to do when given the proper tools.
Absolutely.
Yeah. So with capillaries, we'll talk a little bit about them because they're also part of the chain, in which they're the fine branching between the arterioles and the venules, comprise 75% of the whole circulatory system. So capillaries play an enormous part. And when you have about 100,000 miles of it, yeah, it's there for a reason. And because it supplies the blood to the tissues and the oxygen to the cells, so everything is working properly. Because when cells start to die off or they mutate, it's not good, because then you just have that spiral effect. And that's where you can get, kidney damage, as I talked about, liver damage, heart damage. And they form that network where you can exchange the oxygen, the carbon dioxide, the waste products. So that is so necessary to have that bridge. So that's what the capillaries do. And here is a schematic with the anastomosis, and that's the connection between the two blood vessels. And it's established between the artery and the vein, and that's where you supply the nutrients, take away the toxins. And this vessel actually is under influence of the sympathetic nervous system. So when we're constantly under stress or we're really cold, you know, our body's going to start to shut down, especially with the extremities, hands and feet. And probably some of our organs as well will shut down, like our gut, where that has like so many blood vessels, so much blood supplied to our gut as well. But that anastomosis is so important with the hand, because this is the portal, the doorway, when we put our hand into the Avacen, how it starts to heat up with that dorsal venous, with the arterial venous network, with this palmar arch, and that's where it heats up. And we are able then, that warm blood takes its course throughout the body, especially going to the places that need the most help, such as sore muscles, the vessels that need to be opened up more, and needing to feed the eyes, feed the pancreas, the heart, all our vessels for that matter, our skin, even the cutaneous circulation. It's so important that our skin has adequate blood flow, because if it doesn't, the vessels to the skin, then we're not going to have skin issues at that point. So this then talks about the superficial AV anastomosis, where we do see in the nail beds of the fingers, palms and soles of the feet. This plays a role with thermoregulation in order to keep our body at a certain constant temperature. And it transports heat from the body core. So it's those direct connections. So it is very important that we keep adequate circulation to these areas, because these are the areas that are going to get less fed with the blood supply. So I think we can really sum it up in that, knowing that oxidative stress and microvascular disease are closely related. And then we have damage due to cells, free radicals, toxins. So if we don't get enough antioxidants, if we don't get enough nutrition, proper nutrition for that matter, it's going to be very damaging, because we need a steady supply of antioxidants. I know I'm a firm believer in them as well. Your fruits, your vegetables, should do your best eating as much as you can of them, but we do know that our soil and our farming has definitely been compromised over the years, and that's why supplementation is so important as well. But we need that circulation to continually supply, our trillions of cells. And really, by the time people are over, 40, 45, a vast majority, 75% or so, have some sort of microvascular disease. It's a progression. It's going to happen no matter what, but can we slow it down? Can we improve our health? I've seen it improve my health since I've been utilizing this machine with my circulation as well, because I know I have a family history of circulation issues. But then again, family members did, smoke and maybe didn't have the best diet, and I'm not a smoker. I try to eat as well as I can, taking care of myself, supplementation, and I believe that's, all part of it. It's just a big, and this is once again a game changer in which we can help to increase that body temperature and see so many wonderful things happening once that does happen. So How can we increase it? Well, we're going to turn up the heat. And there you go. That's Avacen. We're turning it up. When you turn up that heat, the vessels are going to dilate. You're going to have more oxygen being delivered. The blood thickness is going to become thinner and flow will then improve. Much like, that bottle of, honey that you have in the refrigerator or the bottle of honey that you have on the countertop. When you are pouring both, you see that if it's colder, yes, it's going to go slower. If it's warmer, it's going to be much, much smoother. And actually then the red blood cells have the ability to deform to that point where they can get through there. Red blood cells need to do that. They can deform and they can contort in order to get through the smallest of capillaries. And that's what their job is, to get there. But if they're unable to do that, they're not going to get there.
Well, could you talk a little bit, Dr. Tropea, I'm sorry to interrupt, but talk a little bit more about the viscosity of our blood and what happens, as we age, as we have injury, inflammation, so on and so forth.
Yes, with blood thickness, there's certain things that can cause that to thicken. It could be when you're a smoker. It could be different disease states that can cause increase in our blood. And if there's too much of the blood, it could then tend to coagulate. We've also seen that there's certain toxins that we can be exposed to that can actually cause clotting of our blood. And if that happens, it becomes very thick and viscous. Also, when we have blockages in the vessels, and blockages happen due to the insult of the tissue around, like just picture a hose, and that around the hose, what that's made of, those are all tissues. And I said before, the parasites. And when they get damaged and insult, the body has to repair it. It repairs it with, say, a plaque, and you get the buildup of plaque. So then you get blockages there. Those blockages can then be so that they can come loose. Then you can throw a clot, and more problems can result because it can land someplace and impede, especially in your lungs, a pulmonary embolism, and that can happen. And even if you have less oxygen in your body, that's what may happen too, is that you're going to get clogs as well and clots. So yes, and then as we get older, then the vessels will narrow, so not a lot of blood can transfer through, and that's what leads to high blood pressure, coronary artery disease, the narrowing of the vessels as well.
When do you see, or do you see an average age where microcirculation starts to become really compromised? I know it depends on all the different risk factors and family history and all of that, but.
Well, I think as you go on in age, and depending on, it's all cumulative. I think it all builds over the years, whether you have been a smoker or continue to smoke, depending on the lifestyle, the stress level. I think it all is cumulative in seeing, and then your genetic predisposition to certain things. How you detoxify, how your body, how much inflammation your body is able to handle. Because inflammation plays a part too. If you have a high risk of inflammation, and usually you can see that by markers in the blood, such as the C-reactive protein, homocysteine level. Those are all different levels, like markers to see, do you have a high level or not? Some of that can be genetically based. Some of that is also lifestyle, watching your diet, eating less inflammatory foods. Like inflammatory foods would be more like the processed foods, as opposed to more natural fruits, vegetables, foods with high amount of antioxidants.
Versus the sugar, the white sugars and the white flours and the ding
Yes.
dongs and
Well, yeah, and I think then that all goes back to what we talked about before, with the diabetes and how that plays a big part because, we're constantly then producing insulin, and after a while, insulin, it just get insulin resistance. Metabolic syndrome is a consortium of a variety of symptoms, and one of them is the prediabetes. And, we have seen with the Avacen that they did the study from San Diego State University with the Avacen and with type 2 diabetics, and saw that there was a reduction with having them utilize the Avacen 20 minutes a day, twice a day, and how their postprandial glucose was much less after they have eaten. So which meaning that you're utilizing the glucose more effectively, the insulin is able to be produced, because with type 2 diabetes, you still produce insulin, it just becomes more resistant. A lot different than type 1, in which there's no insulin production at all. So when we strictly talk about type 2, what we're trying to do is to get the pancreas to become more efficient. And then when we see the decrease in the postprandial glucose, and you could see that over time, that's going to transcend to better blood sugars. And then also that hemoglobin A1C, which is that 3-month average, will also be reduced, because it all works in concert. If the blood sugar is better, and also, your diet, then that plays a big part as well. So what we are seeing is that, once again, the microcirculation helping to utilize the glucose better, and also help the body overall from all the devastating complications of diabetes. And then with this slide as well, this is a great indicator of what happens when the vessels dilate, and you can get more effective detoxification at that level. And also enzymatic and hormonal processes are also going to be working better, because you've given it the proper environment to work better. And especially if you do take, certain supplements, I'm sure it all helps working in tandem, because this is where the parasympathetic system comes into play. When the parasympathetic system is into play, then we get to see how the body relaxes, how the vessels dilate, and you're able to get more nutrition to your cells. So just to kind of wrap up, what we were talking about throughout is, how do you increase your circulation? Well, yes, exercise, the stretching, yes, maintaining a healthy weight where you're not overtaxing your body. And then we talked about massage and different types of physical therapy modalities, to help stimulate that lymphatic system that's so important to reduce the amount of swelling. Once you reduce swelling, healing is definitely accelerated. And yes, adequate water intake, that's important as well, because you don't want to be dehydrated. The majority of us these days walk around chronically dehydrated, and that leads to a whole host of issues as well, because we're not getting enough water and hydration to our cells, and that also is a big factor in our optimal health.
And removing toxins too, right, Dr. Tropea?
Oh, yes, removing toxins. Oh, yes. Well, yeah, we're made up of 75-80% of water, and so our body is much like when you go to the beach and you feel like so connected, because we're connecting with that water, with that energy of our bodies, transcending into that. And that's why with nature and just getting out there, we're able to connect, and that really helps our overall well-being. So, proven scientific modalities, to increase circulation, much like we said, the Avacen, the dry heat, and the negative pressure causes that rise in temperature and blood flowing in the body. And then this rise in temperature, once again, causes easier flow through the capillaries, just everything that we talked about on how it's important to increase the microcirculation. And also, they've talked about, PEMFs, and there are electromagnetic fields to also increase microcurrents to boost the blood flow. Because once again, we're talking also about that quantum energy, and that's another fascinating modality as well, because your cells are definitely in contact with everything that you're doing day in and day out. We call it cell resonance, in which your body's listening, and your body's, well, what you're thinking. So a lot of it has to do with the mindset, wanting to improve. And once people start feeling better, then different things start to happen. If they start to feel better, then maybe they want to go out for that walk. They want to be with other people. They want to eat better, make better choices. So this is definitely something as simple as the Avacen can be so helpful for them, because then it could be that start to, yes, I feel better, I'm sleeping better. Especially I notice when I utilize the Avacen at night, before bed, I really sleep very well, and probably because my body is more relaxed, in a relaxed state.
And this, for anyone who doesn't know what the Avacen device looks like, this is it. And Avacen it's actually been around for 13 years. It was invented for chronic migraines, or they stumbled upon the technology while looking for something to help chronic migraines. And Avacen actually stands for Advanced Vascular Circulatory Enhancement. And this machine, I joined Avacen Medical because, like Dr. Tropea, this machine has truly made such an impact on my own personal life. After a snowboarding accident, have had chronic pain for 14 years and not being able to be helped by any modality, including multiple failed surgeries. And I really had given up hope, Dr. Tropea. And when my massage therapist introduced this machine to me and I started using it, 20 minutes twice a day, I couldn't believe all the benefits and what was happening. Everything from a different kind of mental clarity that I first noticed to, at least a 40% reduction personally in my own pain, but also the great de-stressing and the not having to worry so much, not having to think that this is always going to be the way life is. Because I think, doctors only have so many tools to help them nowadays with complicated patients. And being able to put one hand into the negative vacuum chamber and apply heat, and using that vascular network to really start that natural inflammation cascade to regulate to body temperature. As you said, so many wonderful things are happening during that process.
Yes, and we, didn't even touch upon, or we did for the most part, that, drug-free. And that's unbelievable, because one thing with chronic pain and debilitation is multiple, pharmacological agents. And that's not good either. Having pain pills, having muscle relaxants, anti-anxiety medication, antidepressive. Well, because one thing leads to the next. When you're not feeling well, right away, the mindset, just everything follows suit. And you just don't want to be out there doing things and being happy and saying, I want to feel better. So once again, being having to limit the use of medications, or the possibility of decreasing the amount of medications, because everyone's at a different level. There's some people that are on quite a bit of medicine, and this may be the first step that they can take to start to diminish that, depending on what their situation is, especially if we talk about chronic pain, let's say fibromyalgia. There was also a study with the Avacen with fibromyalgia, in which they saw a decrease in the muscle pain, in the chronic pain, because we know with fibromyalgia, it's a syndrome of different types of symptoms, but mainly it is muscle tenderness. And sure, so if you can have more circulation go there, you can help with the nervous system, help with the vascular system. It's all going to, help improve.
And the medications that are used for fibromyalgia, they're no, party or picnic to be on either.
No.
They make you extremely tired. You're functioning at a far less level. You're not mentally clear at all. And some people never are able to titrate up to an effective dose.
Yes. Yeah. And so then it becomes, like you said, definitely a quandary of, going from medicine to medicine. And then especially if you're on pain medications, I've seen it all through my practice and being in the medical field for over 30 years, with just the increased rise with pharmaceuticals and how much we do take in this country. And so really the shift has to be where more people have to be educated and learn that there are other alternatives. And I think people are open to that now. I think now is definitely the time. With everything going on, people really want to know more, and you want to get the proper information. And that's important, is to get proper information of knowing what other options are there for me and my condition. So that's where the Avacen can come into play. From a, I think we're almost done here. That's Avacen. So like I said, to heal thyself, I think that's where we're at this point. This is a photo that you showed with the Avacen. And as people can, very easy for people to utilize. What, like I said, I have found is people have been very happy with their product. There is a 30-day money-back guarantee, and less than, what is it, 0.5% return rate.
Yeah.
So we know that people are pleased. Multiple family members can utilize it in the house, because we have the gloves, the sleeves, and
COVID friendly. COVID friendly. They're calling it touchless wellness now, because we use sanitary mitts, and each person gets their own mitt. The mitt lasts 2 to 4 months, so that no one is actually ever touching the inside of this machine, and you're able to clean it, which, doctors and therapists don't have a lot of tools and modalities right now, that where they don't have to have human to human contact.
Yes, that's a great point. That's a great point.
And non-invasive as well. I know, Dr. Tropea, your experience with, diabetic wound care, and how invasive negative pressure devices are, effective but invasive for healing.
Oh, yes, definitely. With the wounds, yes, what I have seen is that if the circulation can be rerouted to a certain area, then they're going to start to heal. And also with treating the whole patient as well, making sure that they're optimized, that they can heal, adequate protein levels, and also, vitamin levels in their body, getting them to eat better, that all plays a part. But also getting that circulation to that area can be, beneficial. And there you go. I have seen where the hard to heal wounds have been effective in that respect. utilizing it post-surgically, where people have had, the swelling, like I said before, the swelling reduction, and they're healing much quicker. And then, or you have people with sprains and strains and resistant tendinitis. You're getting the, the healing to begin in that respect from a more natural, from the inside, healing from the inside out. So I've also utilized it where they can rent out a machine. They can rent it out and work with them with the monetary wise per usage or weekly, and then have them at least utilize it for a while. This way they can really get an idea. Or if they're, not sure and they want to try it out, then we can rent out, the machines to them because it's very simple to use.
Yes, and there's a home approved unit and a clinical or a clinic setting unit, and they're both FDA cleared. There's been over 10 million treatments with the Avacen and not one adverse event reported, which nowadays I don't think you see that very often. And so to have a treatment that is convenient, you can use it in your own house, privacy of your own house, or at a clinician's office, but be able to, in a short amount of time while you're having your coffee in the morning or just, watching some TV, that you're just relaxing with this and knowing that you're getting all of these other benefits. My Frank Bestwick, who is a massage therapist here in Rhode Island, he uses the Avacen on patients or on clients before he massages them, because what he says he notices is that it really affects the fascia, right? So it's making the fascia more pliable. So he finds if he puts somebody on the Avacen for 15 or 20 minutes before he starts working on them, it allows him to get deeper faster, and therefore he can make more change. And he can have more of an effect during that session. So I thought that was really fascinating as well. And about Dr. Kodrin, who uses the machine with the Navy SEALs as part of their protocol for opioid addiction, which that's a crisis that you see every single day that we're all faced with, those in chronic pain. And if there's another tool out there, the Avacen has just really been a godsend, and everyone just needs to know that the technology is out there, and everyone needs to have access to it, because we can do wonderful things for your patients.
Oh, absolutely. Yeah, I know all the different points you brought up, and I'm glad you did, because like I said, and it does, it just makes so much sense, especially when we talk about the opioid problem and how people are looking for alternative ways of combating the chronic pain. And then once you feel this way, for me, I feel that then the body can start healing itself. So it's just an amazing thing, because when the body starts healing itself, then you're getting that overall optimization in which, I don't think there's anything else that can beat it, really.
Absolutely. Well, I wanted to thank you so much for your time this morning, Dr. Tropea. I think this was an excellent session, and I hope that all of you physical therapists out there, got a lot of information and some key takeaways from today's lecture as well. So I will leave all of our information. So if you have any questions or comments, just feel free to reach out to myself or Dr. Tropea. So thank you so much.
Yeah, here's my information.
Oh, excellent.
If you want it.
Perfect.
Yes.
All right. Thanks,
Okay.
Dr. Tropea.
Thank you.
Okay.